Good afternoon. I'm George Latimer. Welcome to the 2 o'clock daily Westchester coronavirus briefing. We're here to give you a little bit of update of what's happening with the coronavirus outbreak here in Westchester County. Today's report is going to be relatively short, but we do want to share a couple of basic information, statistics with you. The reports from today that we have from the state tracker is that there are 32,402 cases of coronavirus tested positive over the course of the contagion, which is now a little over 2.5 months. That's an increase of less than 100 positive tests from yesterday. And that means that our number of active cases continues to decline. As of today, we have 2,162 active cases. That is a drop of about 65 cases from yesterday. And it's a steady decline as to where we have been. If we look back to a week ago, Tuesday of last week, we had 3,227 cases. If we go back 2 weeks ago to the 5th of May, we had 5,500 active cases. If we go back 3 weeks ago, the 28th of April, we had 8,054 active cases. We go back 4 weeks ago to the 21st of April, we had 9,852 cases. And it continues all the way back to 12,000 cases. Right now, 2,162 active cases of coronavirus. We have tested 126,496 people. So that is 12.5% and rising. Since Westchester is estimated to be about 1 million in population, it's a very easy piece of math when you know the number of people tested. 126,000 people tested means 12.6% of the total population has been tested. That is a good number as well. We do not have a daily hospitalization number. We believe that it's under 400 at this stage in the game, but we'll look for an exact number, share it with our friends in the press as soon as we have it. The other number that's encouraging is the continued drop in overnight fatalities. Last night, we lost 3 Westchester residents to COVID-related illness. That is the lowest amount of a one-night fatality total that we have experienced since the contagion began. The prior night, Sunday night into Monday, we lost 6 individuals. This is an important statistic in how the spread of the contagion is going, because if we go back a number of weeks, let me give you a comparable example of where we were. We lost 72 people on the night of April 10th. 72 residents died in one night on the night of April 10th. The very next night, the night of April 11th, we lost 50 people. Back-to-back nights, 122 people. The night after that, we lost 46 people. In 3 consecutive nights during that period of time, we lost 170 some odd people during a period of time. Over the last 3 nights, we've lost 3, we've lost 6. We've lost 6. Those are still tragedies for the individual families. Losing a loved one doesn't have a number attached to it, but it shows that we're reducing the number of hospital deaths, we're reducing the number of total active cases, we're increasing the amount of testing that's going on, and we're trying to put ourselves in as good a place as we can. That is not happening because of me. That is not happening necessarily because of government. That's happening because we in this society have determined that we're prepared to make certain sacrifices, and having made those sacrifices, we're seeing the benefit of those sacrifices. And what we hope to do now is to try to balance the degree of sacrifice and the degree of pulling out of this contagion so that we can try to reach a point at which we can resume more of a normal life in the things that we're doing. As we look at the Hudson Valley right now and how the Hudson Valley is tracking along the governor's efforts, we seem to be in a much better place in terms of our metrics today. We are getting closer to being able to reopen. We're hoping that that can happen sooner rather than later. But to be sure that when the Hudson Valley, which the region we're part of, reopens, it is not a wild, wild west reopening, that we phase it. We make sure that we go step by step through different categories. We do curbside retail, then full retail, administrative offices, then open restaurants. Do it in a way that we have a chance to manage the process as best as we can. That is exactly what we've tried to do with our recreational facilities. You've heard me discuss this now so many days. I don't doubt that you could probably repeat the lines that I'm likely to say in the next few minutes. But the harsh reality of it is that when we control our various recreational facilities, we maintained opening our nature centers. And then I made the decision to open the golf courses. I did them 2 at a time over the 6 golf courses. There were some people who said, how could you do this? To have an active sport like golf, you'll spread the contagion. Well, it's not true. It didn't happen that way at all. We've seen a continual diminution over the last 4 weeks that represents the amount of time the golf courses were open. So we made the next step. We opened the Bicycle Sunday program. Bicycle Sundays have been open 3 weeks. We have no indication that anything that happened that first week has manifested itself in a high number of cases. And cases don't wait 2 weeks to be discovered. They're discovered whenever the person decides to take the test. It's the 2-week incubation period when a person gets sick or passes through the period of potential sickness that matters. And we've seen now over 3 Bicycle Sundays, we've seen in general, not perfect. You can certainly go out there and see a moment where there is not social distancing. You can certainly go out and see some number of people not wearing masks. But as a general rule of thumb, many more wearing masks than are not wearing masks on Bicycle Sundays. So we think that's moving in the right direction. This weekend, we're going to try to push the envelope a little bit further. We're going to open up Playland Beach and Croton Point Park Beach. Both beaches will be limited to Westchester County residents. We don't want to have an influx coming from a different geography that could overwhelm us. We're going to try to manage that process. There will be a reduced capacity at the beach. If you do go to one of the 2 beaches, you may find that the beach is closed at the time that you arrive because we have hit the maximum number of people on the beach, and it won't look as busy as it did in past years because we try to maintain that. But we're going to try very hard to maintain a reasonable amount of social distancing as much as we can on a beach. We'll see if that works. But similarly, we're not opening everything all the way. We've already announced that Playland, which normally would have been open by mid-May, now will be closed until at least mid-July. And we're going to lose the 4th of July fireworks at Playland, which is a wonderful tradition. But that's an example where we don't think we could do social distancing. We're going to lose the fireworks at Kensico on the 3rd of July, which is usually a wonderful event. The place is packed. People love fireworks, and the Kensico Dam Plaza is a joy to be a part of. We are going to cancel or postpone, depending on whether there's a chance to reschedule them in the fall, all of the ethnic festivals, which would have started by now, up through July 20th. Same situation. If the circumstances allow, and we can have those festivals start sometime in September and October when they normally would not occur, then we'll do that. And if we find that we're still not substantively along the way in terms of dealing with the contagion, then we may yet cancel additional ethnic festivals, which would be from mid-July into August. But in each of these situations, what we do about festivals, what we do about fireworks displays, what we do about Playland Amusement Park is not the exact same strategy that we use with Bicycle Sunday, with golf, with nature centers, and now hopefully with the beaches. We're trying to make decisions as we go along. This is the balanced approach. This is not the flick a switch and turn everything on. This is not flick a switch the other way and shut everything down. And we're watching the metrics. Every single day when I talk to you, even if it's repetitious, even if it sounds like just a couple of new numbers and the same basic rationale for things, we're seeing a diminution in Westchester County's infection levels from where we were 7 weeks ago, 10 weeks ago. That's what justifies our decisions to try to open up a little bit more and open up a little bit more of what we can do recreationally. Now, it's not within the power of the county executive, your city mayor, your village mayor, your town supervisor, to open up the businesses in our area. That decision resides with the governor of the state of New York. He has superior executive authority within the state. And if you watch television, you're seeing governors all across the United States are using the executive power granted them by dint of being elected governor. I have certain powers as county executive, but the governor has the overarching power. It was his decision to shut down the restaurants, the bars, the barbershops, as you can tell every day, the nail salons, and all the different entities for public safety. And now that he's set out metrics about how we hopefully can qualify, we've had the 5 upstate regions, or 6, I'm not sure, I've lost count. They are in the process now of getting ready to open up to greater economic activity, construction activity, manufacturing activity. In the upstate regions, agriculture is very important. That's part of the first phase. We have some agriculture in Westchester, but really very little as a proportion of the overall economy. Things like forestry are opening up there, and curbside retail, which applies all across the regions that have been opened up. So we're hopeful that we're on the verge of opening up here in the Hudson Valley as well. We're a little different from the rest of upstate. We're a little different from Long Island. There's similarities, but we're different metrics. I'm in contact with my colleagues in the various counties in the Hudson Valley and on the island on a regular basis. And then, of course, New York City is something completely different. A world-class city, highly densely populated, but also the place where many of us work. There was a time in my life when I went to the Metro North train station, got on the train, went into the city every day to go to work. And that part of my life would be changed if my home area of Westchester County opened up, but it wouldn't be changed if we could not go back into the offices of where I worked at the various times in Manhattan. So all of those things will be looked at over the days, and we'll try to give you updates as we go along. But for today, we're getting close in the Hudson Valley for what I hope will be a reopening decision. We hope that'll be a positive decision. We're going to be opening, as I said, Playland Beach and Croton Point Beach on Friday in anticipation of the full Memorial Day weekend, Friday, Saturday, Sunday, and Monday. Going to open from 10 a.m. to 6:30. 50% capacity for sunning and swimming, not 100% capacity, 50% capacity. And we're going to try to manage that process with our personnel. We will then close for the weekdays to follow, Tuesday, Wednesday, Thursday, Friday. We hope that the assessment of how we did over this Memorial Day weekend will then allow us to open the beach for the following weekend on Saturday and Sunday. And this is very consistent with what we normally do. We normally open the beaches on Memorial Day weekend. So if you look at golf courses, bicycle Sunday beaches, we're doing exactly on schedule what we would have done. The ethnic festivals now are off schedule. The firework displays are off schedule, and Playland is off schedule. There will be no capacities, no capacities for concessions, I should say, in any of our facilities. So where you might normally have the ability to, buy certain things off of the beach, we won't be able to do that right now. We don't want the clustering that comes around the beach. This is consistent with closing the restaurants at the golf courses. So the golf courses are open, but you can't go to the restaurant, the 19th hole, if you will, at the end of your round of golf. So it doesn't give you all of the options you'd like. We do want to report that antibody testing has now been opened up to the general public. Westchester Medical Center Health Network is expanding the program. Beginning today, the public is able to get tested for COVID. The number that they can call is 326-2060, 326-2060. Appointments are available Monday from 8:30 in the morning to 6 p.m., Mondays through Saturdays. So that gives a broad base of time for individuals to be able to come, get screened, and make an appointment. It is a donation of a vial of blood, which is then processed and determined if you have the antibodies that fight the COVID virus, and hopefully that will be helpful for all to see. But antibody testing has been opened for all, and we think that is a very good thing. We want to mention that this week is a week to celebrate our emergency services personnel, our first responders. This is EMS week in all of our local communities. We want to show our respect to those people who, no matter what the circumstances are, leave whatever the comfort of their environment is to come out and help us. People have a heart attack, people that are in car accidents. Anytime that human life is threatened or damaged, they respond. And along with our firefighters, with our police officers, and now we have to include our health professionals in the same category of first responders. They really deserve our respect. Some of them volunteer. Some of them work all types of difficult hours, and they put a tremendous amount of time in it. So we definitely want to thank our EMS personnel, and we're very hopeful that you'll extend that thanks to them as well. As you drive around the county, you'll see some people put up little signs on their lawns, thanks to all the first responders, and they'll identify it. And we think that that's the right sentiment. It's an attitude of gratitude that we have for people who put themselves out there for us as civilians, and we owe them, at the very least, this gratitude during the course of the week. Tomorrow, we're going to have our 2 o'clock update out at the Westchester County Airport. The airport has functionally been shut down for the better part of the last month or so because of the reduction of commercial air flights and the deep reduction of other types of flights. So we went ahead and closed the runway so we could complete a repaving project that has been long planned. By doing the repaving project in one fell swoop, we saved the county some money that would otherwise be spent by trying to do a piecemeal and keeping the airport open around it. This was the silver lining that comes with the dark cloud being the pandemic, the silver lining being an opportunity to do certain things that we couldn't have done the same way otherwise. The repaving project will be completed by the end of tomorrow. However, many of the airlines won't be back in business until July. Maybe there'll be some in late mid-June. For those who worry about the overhead noise from airplanes, they're getting a bit of a break over this period of time, and there's a quietude that exist because the airline industry is really one of the most impacted industries by the economic downturn that comes alongside this COVID infection that's going around. What happens in the future, we'll see. But the bottom line is that tomorrow we'll be at the airport and we will recognize the reopening of the runway. Keep in mind, the repaving of the runway was not a strengthening of the runway, and it was not a lengthening of the runway, meaning that people will argue that this was done in order to let bigger flights come in from further distances. It's not true. That's absolutely not true. It's a simple repaving. It has to be done roughly every 20 years. This was the time frame that it was scheduled for the redo, and we went ahead to redo it. It is, the airport is an important transportation hub, but we have no plans, no desire to expand it. And what we did was prudent for public safety, and that's what we've done, and we're glad that that project is behind us. We are very happy to hear that we're going to get from the United States Department of Transportation's Federal Transit Administration a $30.2 million grant, which is awarded to the County Department of Public Works and Transportation for the B-Line bus system. And that is part of the Coronavirus Aid, Relief and Economic Security Act, the CARES Act. That money will be used to help operating, preventive maintenance, and administrative expenses for the B-Line bus system. And you may recall, if you're a regular rider of the B-Line bus system, you know this every day, we've had to cut back on service because of the many people that are no longer employed or are working at home and don't use the bus normally to commute into the city or for any other transportation around the county. We've had to cordon off the bus passenger area to protect the driver from the potential exposure to COVID. And so therefore we had to suspend taking any fares on the B-Line bus system. If you're a regular B-Line bus rider, you know, you have the benefit of not having to pay fares, but that creates a financial hole for the county by not being able to collect fares. And then also reducing the number of runs, we reduce a lot of revenue that is part of how we fund our government. So this money will help us make up for those expenses, administrative as well as the maintenance expenses that are important. It also applies to paratransit service during this health emergency. And so we're very appreciative for all of that that's come to pass. We understand that the governor has set out some rules as well by which Memorial Day ceremonies can occur. Under his prior executive order, no gatherings of any size were to be allowed. We believe he's opened the door for some of our local VFW groups and American Legion groups to celebrate Memorial Day, which the weekend, of course, Friday through Monday, the legal holiday of Memorial Day on this coming Monday. The traditional Memorial Day is on May 30th. And we think it's an important celebration. We've missed a lot of celebrations that are important to us because of this virus. In our major religions, the Jewish celebration of Passover, the Christian celebration of Lent and Easter, the Muslim celebration of the month of Ramadan have all happened in this environment where we're communicating in this fashion rather than face-to-face and in person. We lost the joy of St. Patrick's Day. We've lost the joy of Cinco de Mayo. We lost the joy of Little League season and opening day. We've lost the whole Little League baseball season, this lost spring of 2020. Our high school and college seniors look forward to the last few months of their senior experience and the senior proms and in high school and, you know, all of the enjoyment, the last time you're going to see those high school kids, the last time you're going to see those college kids before you go on with the rest of your life. All that's been lost. All of those symbolic events that mean something to us as Americans and as people have been lost because of the virus. It's a very small thing to lose because you're going to lose human life. And that is the most important thing we've lost. But we don't want to lose Memorial Day. Memorial Day has a special place in our hearts. This is the day where we recognize those men and women who made the ultimate sacrifice for this nation, who went to war, put themselves in harm's way, and lost their lives. And it's a compounded tragedy because mostly they were young men and women. They're 18-year-old boys. They were 22-year-old men. They had their whole lives ahead of them. And their lives ended on the shores of Normandy. Their lives ended in Iwo Jima. Their lives ended at Pork Chop Hill, the Chosin Reservoir in Korea, or they ended in the Middle East and many of our more recent conflicts. There's so many places where American young men and women have been asked to go and put their lives on the line. And for those that don't make it back, we put their names on a plaque in the town square on a monument. And we pass by that monument 363 days of the year. We stop by there at Veterans Day, in which we honor all veterans, everybody who put on the uniform of the country on Veterans Day. But the 1 year we set aside, 1 day a year we set aside is for Memorial Day. And that day is coming up. And so hopefully with this opening of the process, we'll be able to have some of those ceremonies that are important, that we think are valuable and necessary. And if we can do those kinds of recognition things, we think it's important. You know, some of our communities, Eastchester, Rice City, they're doing some virtual recognition things on video that will be shown on Memorial Day, both on social media and local cable television. We know that there's some plans that will be inside cars, car parades in certain communities. But we can't afford in the middle of this pandemic to lose the fact that Memorial Day means a lot to us. And we'll see where we are come 4th of July. I hope we'll be in a position where if we don't get fireworks, we can at least celebrate the independence of our country with a little more community feeling. But whatever we do, we'll focus on dealing with the issues maturely and responsibly, which means deal with the health crisis, deal with the economic crisis. Don't make it an ideological battle where I'm on this side of the continuum and so I don't care about that, or I'm on this side of the continuum and I don't care about that. All of these things fit together. We're a nation of very different people. We have different ethnic backgrounds. We come from different life experiences. No two of us are alike, even if we're, you know, two kids born in the same family. And we have to recognize that we are literally in this together. This disease does not know what ethnicity you are. They don't know if you're tall or short or thin or fat. They don't know if you're Christian, Jewish, Muslim, Buddhist, Hindu, not a person that doesn't have religious tradition. And the economic downturn does not respect whatever your demographics are. I don't care if you're a man or a woman or, you know, whatever your orientation may be. None of that is a factor in the dual crises that we face. And the responsible level of government response is to deal with both crises, to try to solve both issues. Solve the healthcare problem. Do not ignore it. Do not try to push it aside. These are people living and dying. Do not treat the economic crisis as if it doesn't exist or would deal with it, you know, in some distant period of time. We can do both together. This is a nation that at one point in time had the Great Depression and World War II sitting side by side with each other. We were a nation that was fighting World War I when the great pandemic of 1918, 1919 hit this country. Somehow our parents and our grandparents figured out how to work through these things. And I think they look down on us and expect us to be able to do this too. They expect us to do this knowing that we have disagreements, but not turning this into one more opportunity to fight with each other over ideology, but to find a common way for us to solve the problems that we face. And that's what we're going to try to do. Here in Westchester County, that's what we're going to try to do. We're going to try to deal with both of these issues at the same time, deal with it responsibly, move forward, at some point get back to whatever the new normal is going to be, and then go on with the rest of our lives and grieve the lives of those that we've lost, just as we do on Memorial Day, just as we do in the ribbons of remembrance down at the Noir Preserve. Because what kind of people are we if we forget our dead? What kind of people are we if we just go on in the highway of life and the people that were with us who are no longer with us really meant nothing to us and we just go on? That's not right. So let's do the right thing. And together, we'll get through this. With that, I'll ask Catherine Chaffee off camera if we have any questions from the press.
We do. We have a few questions. The first one comes from Jonathan Bandler. He says that you mentioned that New York City people likely will come up to the beaches. With limited capacity, any consideration to restricting entry to county residents only?
Well, we have made the decision to restrict access to our two beaches to Westchester County residents only. It's Westchester County property taxes that pay for these facilities, so we want to make sure, since we have limited attendance, it's Westchester County residents that have the opportunity to do that. Our neighbors to the south are our neighbors and friends. If they get sick, they're welcome to be in our hospitals. If they want to have an enjoyable night out and they come to a Westchester facility, we're happy to have them in the same way that many of us go into the city. But New York City has made a decision not to open their beaches. That will put the city of 8 million people in a situation where they could easily flood and overwhelm Westchester County, Nassau County, Suffolk County. So we have to make sure that we're doing what's right for our residents and our citizens. So we cannot have an unmanageable number. If New York City chose to open their beaches, we wouldn't have the same pressure on our beaches. And keep in mind that we have lost the Glen Island facility, which is larger than the other two in terms of their capacity. because we turned that over for the state testing program. So we made a sacrifice, and now this sacrifice has become real. When we did it back in March, Glen Island's a nice place to walk around in the wintertime. But now that we've reached the spring, on the cusp of the summer, we've lost one of our great recreational facilities in quest of healthcare. So we will have residency requirements for those who visit us. We hope to manage the process well, and we hope that we can continue to keep them open going forward. And then we hope that New York City will assess their circumstances and make whatever decision is right for them. If that decision is to open their beaches, that would certainly take a fair bit of the pressure off of the Westchester, Nassau, Suffolk, New Jersey, Connecticut beaches.
Okay, the next question comes from News 12. They ask, are county workers at all county levels being forced to take a computer course on how to become a tracer?
Now, no one is being forced to become contact tracing. We've identified individuals that would have the skill set. It is still an optional situation, and we're trying to make sure that we get the appropriate number of people into contact tracing, but it is not a requirement. In point of fact, we could not require it because there's a host of protections that our unionized workforce has from these kinds of things. But for our workforce that is not working in the present within the context of their offices, we're still basically working with a remote workforce, except in those departments that require the presence of the individual. The Department of Public Safety requires your presence. The Department of Environmental Facilities running sewer treatment plants requires your presence. We are trying to identify those positions that can be contact tracing and use their skill to do that. Ultimately, if the county reopens as a government, and that might happen, as soon as a few weeks hence, we'll need all hands back on deck. So whatever we do, we're doing for the short term, even as we now invite as many people that want to seek employment as contact tracers reach out, and hopefully we'll be able to work with them.
Okay, the next question comes from Jonathan Jordan. He asks, the latest statistics from New York State's monitoring dashboard has the Mid-Hudson region achieving 5 out of the 7 metrics for reopening after falling to 4 out of 7 yesterday. Can you tell me what measures are keeping the Mid-Hudson from reopening, and when do you expect the region to qualify for beginning the first phase of reopening?
Well, I think, as I look at statistics from Westchester, which are not the total region, we're 42% of the region, we're the largest single piece of it, but we're not even a majority of, and certainly not the totality of it. I think we're as close to opening as we can be, short of being open. And I would be, I would be hopeful that within the next 7 days, if not sooner, we can meet those metrics. There are certain metrics that are accumulative, and some of them are diminutive. The accumulative statistics are, how many hospital beds do you have? We physically have the beds necessary. How much testing are you doing? We have physically tested enough people. Those metrics are solid. We're not backsliding on those metrics. Those accumulate. Everybody you test, any beds that you might add, just add to an inventory and help you qualify at a higher level. The diminutive ones are the ones where they're looking to see a diminution or a reduction in the rate of hospitalizations, deaths, new hospitalizations, and so forth. The county can't really control those types of things. The government can't control those kinds of things. And the reason why those metrics are in is as a check on whether or not the contagion is spreading. So we can do certain things, but that may not directly deal with the contagion itself. The contagion spreads and we see more hospitalizations, more deaths, and then more new hospitalizations out of the total. The numbers, I think, are so close that much of this becomes an interpretation by the state of how they choose to register some of them. I made the point, I'll give you one example. I made the point a couple of days ago in conversation with state officials. I said, if you're looking at a new hospitalization number, an absolute number, you want that to be low, make sure that the new hospitalizations are people that, A, do not live in another county and happen to be coming to a hospital here. If they caught the disease in New York City, and there's not enough beds in New York City, so you're sending them to Montefiore, New Rochelle, or to St. John's or St. Joe's, or to Montefiore, Mount Vernon. They're being treated in Westchester, but they don't track as an example of the virus spread in Westchester because they live in the Bronx, and what would have happened to them in the Bronx. You can't trait that on us. You also can't take a person who may have gone to the hospital at Lawrence Hospital or at Phelps or Northern Westchester, and then you transfer them to the Westchester Medical Center, which is a tertiary care facility for people that have more severe illness. If you do that, that new hospitalization at Westchester Medical Center is not an additional hospitalization. It's a redirection of somebody that's already in the system as being hospitalized at one of the primary care facilities. And while it may seem like I'm arguing semantics, it's very essential if you're going to say you don't diminish the number of hospitalizations. If you fail to do that over 14 days, even if you get to the 12th day and you miss the number, you go all the way back to a 14-day wait. That isn't a fair assessment of whether or not there is a spike or an additional spread. You're talking about the way you track people. And if you track them, I think in a proper way, you'll see that there's a continuing diminution. Now, the reality is you can make one of those metrics, such as the net number of people in the hospital. You have 400 people in the hospital right now being treated for COVID. Let's say 35 people get released. They're cured, 35 people have left, and you have 25 new people come in with new cases of COVID. Your net hospitalization went down another 10. And every single day you're releasing more than you're bringing in. It shows a diminution of your hospitals. But the people that you're bringing in, separate standard, can only be up to 20 or 2 per 10,000 people of population, or whatever, 10 per 100,000 people of population. That metric isn't a broad enough metric to absorb the fact that the people that are coming in are less than the people going out, and that one metric alone is stopping us from satisfying. So I think there are ways to look at these things and interpret it. In my corporate career, we would look at all kinds of statistics. We'd look at rate, occupancy, we'd look at frequency, repeat business, source of business, lots of things to tell us what was happening in the marketplace. But at the end of the day, it's not the numbers that count, it's the overall subjective assessment that you make from those numbers. And I think the Hudson Valley, like the other regions of New York State, are moving close to being open. This is the call that the governor and his people make. It is not my call, but I think we're close. I think we should be over the line very shortly, open up to the first phase. I predict we're going to continue to see a diminution through that first phase. Then we get to the second phase, which is opening up all of retail, and we open up all of the administrative offices, all the business, the legal firms, finance departments, insurance companies, real estate organizations that are in offices. We start to open up, and then we monitor, and then we see, do we get a spike in new hospitalizations? Do we get a spike in new infections? Does it tell us that something is going on that we should take note of? Or do we see the continued diminution? And I think we've hit our peak. If there's a second wave coming, and it comes, it won't come in the short term. It'll come a little further down the road. But if we do, in fact, open, we still have to socially distance, still have to wash our hands, still have to wear masks. And I think we do those things as close to 100% perfect as we can, and we'll get through this.
Okay, the last question comes from News 12. They ask, with Memorial Day weekend coming up, can you recommend some safe, fun things for families to do in the county?
Well, I think, we've talked a lot about our recreational parks for Westchester County. Almost every community has a park that has within it a plaque or a monument dedicated to our veterans. And I have made a point, if anybody follows me on my personal Facebook page, I've gone out and taken pictures of some of those monuments, and I've pointed to, the communities that have these monuments. If you go into downtown Harrison, Reese Park, which is between the library and town hall, there's a wonderful memorial that is there that shows all the names of the people in Harrison that have served as veterans. Now, if you go to that park and you have a couple of kids and they're little ones and they're going to run around and you have a ball, you play with them, I'm far from being a young parent now, but of a certain age, you're there and you enjoy the great outdoors. It's a nice sunny day. You're playing with your kids outside. But go over to the monument, take a picture next to the monument, look at some of the names, and understand that there is a way to both enjoy the Memorial Day weekend, because it is the beginning of the summer, but at the same time, give honor to the veterans. Veterans Park in Portchester, you have a monument on the grounds of the Larchmont Village Hall. You have monuments right next to North Castle Town Hall, on Bedford Road. Right next to it is the American Legion Post 1097, and they have a monument with names on it there. Both, Bedford, Bedford Hills, and Katona, the three hamlets of the town of Bedford, have these different things. VFW Post 375 in Yonkers on Huber, right off of Central Park Avenue, just on the other side of the raceway, right around the corner from the Raceway Diner. They have a little monument that honors our veterans. You can go out, enjoy the great outdoors, and take a few seconds and remember the veterans too. If you have somebody in your family that you're going to go to the grave site to pay respects to, look for those flags that have look for those grave sites that have an American flag on it that represents somebody who lived and died and did so in the service of their country. And I think that's a way to both have fun, enjoy the great outdoors in the parks, and at the same time remember our veterans. I think we can do both. So with that, if there are no more questions, any members of the press are welcome to give us a call separately. We'll be happy to follow up on any more detailed questions as they arise. Obviously, if we have any information to announce between now and our regularly scheduled times tomorrow, we'll let you know. 11 a.m. tomorrow morning, we'll have another one of our Facebook Live COVID conversations. The one that we had earlier today with Robbie Schlaff, who is the Executive Director of the Office for Women, spoke of some of the issues we dealt with. And if you go on our Facebook page, Westchester County Government, you'll see a number of different interviews we've done that you can see through the archives. If you really are in the house with nothing to do, you can watch these videos for the rest of the afternoon. I doubt you will. My blessed mother, were she alive, I don't think would sit and watch all those videos of her son. But they're there for you to watch. And then, of course, we'll be back tomorrow as I promised at 2 o'clock. Give you an update on numbers. The numbers continue to do well and continue to show the diminution. Let's hope we can say that again tomorrow. In the meantime, be safe, take care, enjoy the nice weather, and be smart out there and do the things we have to do to get this thing behind us. I'm George Latimer. Have a good day.